It is time once again to explore the hospice story, and all month long we've been shedding new light on this facet of medical care. Today we'll talk about one of the more difficult aspects, the decision to end life support for a loved one. Here to help us are Dr. Jennifer Hirsh, the medical director of Zusman Hospice, Dawn Havens, a registered nurse, and Rabbi Sharon Mars, all a Zusman Hospice chaplain. You're all with Zusman House, and it is a pleasure to have you all here again.
Thank you.
And it is a difficult topic, but I'm so glad that we are going to discuss it openly and honestly, and hopefully if there are people at home watching this, going through this, that we can help someone today. Doctors, let me start with you because I think that is a heavy burden for a family. Mm-hmm. How do you start that counseling process when this decision has to be made?
Ideally, the discussion is part of a long process. As a loved one is in usually the intensive care unit setting, there are a number of people who are involved in their care. Intensive care physicians, nurses, chaplains, and social workers. And hopefully it's not a surprise.
Yeah, it doesn't come out of the blue, or it shouldn't.
Right. I mean, occasionally it does. I mean, sometimes a devastating illness has put us in that circumstance. Oftentimes this is the progression of a longer illness, and this is a conversation that hopefully we've been having with time, that an individual has been able to communicate with their family what their wishes would be. But generally speaking, in the medical setting, intensive care physicians or nurses asked to set up a family meeting and involve chaplaincy again and social work and bring together all of the members of the family who can help participate in making a decision on behalf of their loved one. They review the clinical situation, kind of where we are, what our options are, and we come to this idea of discussing what are the goals. What are the goals for the individual who may or may not be able to participate, and what are the goals for the family in light of understanding the clinical situation.
When you suggest that it is time to remove life support, can a family say no? And do they?
Absolutely. It goes both ways. We have the right to refuse medical treatment, even life-sustaining medical treatment in the United States. We also have the right to ask for medical treatment to be continued. Ideally, this is a conversation, and the physician and supportive team can say these are the things that are appropriate at this time, these are the things that are not appropriate at this time. And given those medical choices, the physician and team can help the family make an appropriate decision.
Well, Rabbi, while the family is being talked to by the medical community about the physical aspects of all this, you are there to help with the spiritual part, because that's so important as well. You can't do one without the other here. How do you start that counseling process?
Well, it's a really important thing to engage in decision making with the family and the patient, hopefully, if we can do that, and to start guiding them through this kind of emotional minefield which they're about to approach, to make these really tough decisions that are coming up. What we do is really look at them on a case-to-case basis, and I can't emphasize that enough, because we are talking about working as a faith-based organization. In particular, we pay very big attention to the fact that there are a lot of implications to this. And so we treat each person on the basis of how do we help them maintain their dignity, how do we honor their wishes, how do we do according to what they would want and according to their beliefs, and really guiding them from the beginning, preparing them for this, all the way through supporting them and through the grieving process as well, if it comes to that.
Dawn, can the family be there when life support is removed?
Absolutely. When we bring them from the hospital to our Zusman house, or even their home, we can go home with them on the ventilator. We encourage whoever wants to be there, including children, family members, pets. We've had pets on the beds. So that's an important part of making this decision, and when they do make the decision, making sure that whoever needs to be there with the patient is there.
Dr. Hirsh, I know a lot of times, probably most of the time, the patient is unconscious. They can't make this decision. So most of the time it is a family decision. And I know you recommend that families talk about this years before. I mean, just make it a topic around the holiday table. That what if this does happen to someone here?
Absolutely. And we're approaching Thanksgiving, and I would say this is something that my family's been discussing at the Thanksgiving table for years. It is the idea of having your loved ones know what you would want, so that when they have to make these tough decisions on your behalf, you've either discussed it or ideally you've even put it in writing, and that helps alleviate some of the guilt of making these difficult decisions, and so that we know that we're not choosing life or death, we are respecting that it happens for all of us, and that we can't affect when and we come into this world or when we leave, but ideally that we can help affect how and where that happens by having these discussions early with our family.
And Dawn, I think it's interesting. I didn't know the family could be there. I thought medically it was something that, they're not invited into the room. And it's really wonderful to know that it is possible. And I know, Rabbi, you probably feel the same way. So that it is all-inclusive and everyone is together for this.
Absolutely. It's an amazing process that we go through, and it's a gift to be able to provide these families with this.
I'll bet. Well, thank you all so much. And then, as I've said before, this is a discussion that we could even take further. We don't have the time, but at least maybe some folks will be talking about this around their table this Thanksgiving.
Thank you
all, and have a great holiday.
You too.